Hi, I'm Dr. Flores. I'm a veterinarian at DTLA Vets, and this is my patient Cricket. Cricket is, as you can see, fitted today with an esophageal feeding tube, and in this video I'm going to show you how to use one, what we use them for. An esophageal feeding tube is a very safe and effective and simple to use way to make sure that a patient gets all their nutrients in cases when they can't eat or won't eat on their own. The feeding tubes can be placed in cats and dogs. More commonly, they're placed in cats. They tend to be a little more stubborn about not eating on their own. An esophageal feeding tube is placed within the neck. It does not hinder her movement. It's quite comfortable for them. It does enter the body through the skin. We'll show you that in a minute. And it is placed midway between the back of their jaw and their shoulder. This does not prevent them from eating on their own. They can go ahead and eat anytime they want, starting from the first day we place the tube till the end. Today we're going to show you on Cricket how to do feeding with an esophageal feeding tube, as well as troubleshoot problems and do general maintenance. We have a collection of supplies we use in maintenance and care of a feeding tube. We have an antibacterial scrub that we use to keep the site clean. This is just a saline-filled gauze to wipe clean. This is an antibacterial ointment. You can also use a betadine type ointment to keep the site clean. Once you've cleaned it and want to just replace a little lubricant there at the site of where the esophageal feeding tube is placed. This is a gauze pad we place at the site of where the esophageal feeding tube has entered the skin to absorb any debris coming off of the stoma. This is a Q-tip we can use to clean that stoma area before we place the ointment. Then we're going to move down here and you'll see we have syringes for feeding and food that has been blended to a very watery consistency to go through the tube very easily. This food is usually is definitely a special food. It's usually a prescription diet with a high caloric content to reassure that we know we're getting the proper nutrients in a smaller quantity. It does have a lot of liquid in it, so it does also give them their water every day. We will often use something such as Coca-Cola or other bubbly soda in order to unclog tubes if we do get a clog. We try to assure that we use a very dilute but nutrient-rich food to prevent clogging, one that's been blended quite well. But on occasion we do get clogging. Remember, we are putting medications through this tube as well, and so on occasion you will get things stuck in the tube. And there is some maintenance of placing small amount of a fizzy soda such as Coca-Cola to unclog that tube. Okay, so now I'm going to take off her kitty collar here and show you what it looks like that the tube is placed into her neck, as well as what we would do for general maintenance care. This Velcro just releases this, keeps it there just for comfort for the patient so it's not flopping around. So you release that, reach under, there's a Velcro strap underneath that we remove. Then we just slide this off over the tube, give her little neck a break from her nice soft kitty collar. So you'll see here, this is actually one the owner has placed today. The owner is pretty versed in this at this point. It's been about 3 weeks. So I'm just going to remove the tape so that I can remove the gauze. You'll see here there'll be what we typically call a Chinese finger trap. That is suture material that is sewn to her skin as well as wrapped around the tube. We use a non-absorbable suture for that to hold in place. You will use the chlorhexidine wipes to clean the stoma area. At this point, she has quite a bit of general normal scabbing around the area, and that is quite fine. You just clean it, soak it down. Once you clean the stoma well, you can take scissors and cut your pad so that you have a place to hook it around the tube. You can even make a little circle here. I'll now place a little bit of ointment on the pad. You can as well, triple antibiotic ointment that is, and you can as well put it directly on the patient. In our case, Cricket is feeling so good these days, she won't stop grooming herself. You just place the pad around the tube, around the stoma, like that. After you place the pad around the base of the tube and at the stoma site, you can put the kitty collar back on. Alright, I'm now going to show you how to administer water and food through the esophageal feeding tube. We have 2 syringes here, and I'll use 2 separate syringes. In my first syringe, I'm going to pull up 12 cc's to 15 cc's of fluid. Generally speaking, the distance of the tube can hold about 6 cc's or milliliters of water at a time. So I like to pull up about 12 to 15 initially, so I can flush it once, then give food and flush it again. I'm then going to draw up, and for today's example, I'm just going to give her about 15 to 20 cc's of food. I recommend that when you do feeding, you find a comfortable location for you and your cat. Sometimes that's best on somebody else's lap while another helper helps by administering the food. Sometimes it's on a table, on a blanket, in their special bed, but a special place is always a nice thing. Alright, so the first thing we're going to do when we feed the cat with esophageal feeding tube is free the tube, so we have access. Remove the cat. Every esophageal feeding tube that anyone may place could have a different system here. In our case, we needed to use a wide tip for our syringes, which are catheter tip syringes, and so we have a little bit of a makeshift cap here. So the first thing I'm going to do is flush it with water. And as I mentioned before, the entire tube length, 6 cc's, is plenty to flush the whole tube length. And you'll see I will gently put in 5 or 6 cc's, just make sure it's flowing and I'm not getting any resistance. Now here's her food. You want the food to be room temperature or warmer. Remember, it's going directly into her esophagus. We don't want ice cold food going in there. That's not comfortable. Now you want to always start by feeding fairly slowly. There is no magic one number for every cat that is the perfect feeding speed. I generally like to think about myself as giving about 5 to 6 cc's over the course of 30 seconds to a minute at the fastest. So after feeding our cat the desired amount of food that we wish to give, we then flush again with another at least 6 cc's of fluid to make sure that it's flowing nicely and the tube is empty and clean. And then recap it when we're done. I want to thank Cricket and her parents for letting us use her in today's video, and remind you always to use all medications prescribed by your veterinarian as prescribed. Everybody has a different plan for every different case, and they should be adhered to.